Well, actually, cervical cancer is probably one of the cancer in the human, in the mankind that we almost fully understand what is the cause of the cancer. So for the past 10, maybe 20 years, that we know that disease have a definite cause for this kind of cancer. When you compare to other cancer, you may see that we still do not know what is the exact cause of the cancer. No matter what's the cancer of the breast, cancer of lung, cancer of liver, for example, we know some of them may cause from some kind of virus, for example. But in the cervical cancer, 99% of cervical cancer will be caused by the kind of virus called HPV, or human papilloma virus. Now, what is the advancement for the past 10 to 20 years? This is one of them. We know the exact cause of cancer that come from this kind of virus. So we can develop the prevention method, or so-called the cervical cancer vaccine. And secondly, since we know the cause of the cervical cancer from the virus of HPV, then we can develop the screening test. For over 80 years, we use the cytological test, or sometimes we call pap smear test, as the screening method. But right now, because of the development of the HPV test, which is more sensitive in terms of picking up the risk woman, so the combination of pap smear and the HPV test will increase a lot of sensitivity in pick up the woman at risk. When you compare with the pap smear alone, the false negative rate of the pap smear is almost up to 40%. So the false negative rate of the pap smear, which may be sometimes up to 40%, that's mean 40 women out of the 100 women that we screen maybe have a negative result, but actually may not be. So this is one of the pitfalls of the pap smear, but since we use it for over 80 years and it's kind of cheap method, and most of the doctor and medical personnel can do it, so we're still using it. But right now, with the advancement of the HPV test, it will reduce the interval of screening sometime from every year now up to every 3 to 5 years, for example. And the sensitivity may be up to over 90%.